everybody, and welcome to the next episode of Infection Control Matters. Phil Russo here, and today I'm joined by Brett Mitchell. Hi, Brett.
G'day, Phil.
Good to see you again. Talking about something that we both enjoy and dabbling in every now and then, Brett, and that's social media. And we came across an article, or you came across an article that was in preprint after peer review in Journal of Hospital Infection, titled YouTube and 2022 Monkeypox Outbreak, Opportunities for Awareness and Infection Control. So tell us about this article.
Yeah, it was an interesting article. I guess maybe by the time this podcast comes out, monkeypox might well be renamed to something else, but we'll run with it for now. Yeah, I guess this is interesting, and we've talked in previous podcasts a little bit about things like gaming and touched on social media a little bit in the context of infection prevention and control. But I think this sort of article hits home on a number of fronts, particularly some of the challenges we probably face with COVID-19 as well. And so, this article is focused on YouTube. And, YouTube is, of course, predominantly video content. But the authors are interested to look at incorrect or misleading information that was being put out on YouTube with respect to monkeypox, being quite topical, of course, at the moment. So they did a search on one day, and they just simply looked at the 100 most viewed videos when you typed in monkeypox into YouTube, the search on YouTube. And they filtered that by most viewed. And they looked at the top 100 of those. And then they got two reviewers to look at those videos and classify them as either useful, misleading, or neither. And they used publications and guidelines from the CDC and WHO as their sort of reference point for, I guess, whether those information that's provided in those videos was, in fact, misleading. They also categorized the content into different areas like epidemiology and symptoms and treatment and various other things. So, Phil, one interesting thing was that these videos, the first 100 videos at least that they found, 100 most popular, they were viewed 23 million times. Now, we haven't quite got that just yet from our podcast here, Phil, but maybe one day. That's an extortionately large number of views, isn't it?
It is indeed. It is indeed. I just guess just show how I suppose people are just typing in monkeypox search and the YouTube video comes up.
And, that was the first thing that struck me about this article, because it made me think, wow, that's where people are going to get sources of information from and do exactly as you probably just described. And what are we doing in our space, public health, infection prevention and control, to communicate on these types of platforms? So anyway, that's probably another point for a bit later. But anyway, of those 100-odd videos, they had to remove quite a few because they were non-English speaking. So they ended up with 67. Now, of those 67 videos that they reviewed, they found 2/3 were useful and about 20% were misleading, and about 10% were neither useful nor misleading. And so, that's not an insignificant number, or 20-odd% of videos being misleading. And bear in mind that these have been watched 23 million times.
Did they also look at the sources, Brett, of the videos and who produced them, or who presumably somebody was presenting information in those videos?
Yeah, that's right. They did actually, and they found that videos that were uploaded by healthcare professionals or public health individuals were all classified as useful, and that independent users were more likely to post misleading videos than useful videos. It was something like 2/3 versus 10% in terms of misleading versus useful for independent users. And,
so an independent user is just you or me just putting up our own YouTube video. Is that?
Yes. Well, if we're not a healthcare professional, yeah. So if we were just a member of the public, I guess. So I found that that was interesting. So I guess that's one good thing, that healthcare professionals and those with expertise are putting up useful videos. That's great. But a lot of misinformation was coming from non-healthcare, non-public health individuals. But the other interesting thing was misleading videos had a higher number of likes compared to useful videos, and statistically significant difference. So people were liking these misleading videos even more. So yeah.
Was that a number of views, or I must admit I'm not that au fait with YouTube. So you like
it, or you can
like it or you dislike it.
Yeah.
Okay, so it's not just watching it or downloading it; it's also liking and disliking.
Oh, that's a good question. I don't know if there's a dislike function to that. So whether the like is comparable to people who didn't respond to either liking it or not responding to that. But it's fascinating. It's fascinating because it just shows how conspiracies and misinformation could spread, both because the large number of videos that are being consumed and put online and number of views, but also that people seem to be liking the ones that are misleading.
So I was just going to say, was there any particular content areas that they were more misleading? Like, were they more misleading about modes of transmission, or the symptoms, or was there anything that those was there any sort of comparisons there?
There was, I guess, that those misleading videos, the majority presented messages of conspiracy theories about a fake outbreak created by international companies to sell vaccines. And there were some other conspiracy-related thoughts there too. So I guess that's perhaps one thing. People like a good conspiracy, and perhaps more likely to watch it and comment on it. I guess there's a few things that also came from this, and that is that this is a platform that perhaps we could utilize better in infection prevention control to increase awareness of things like transmission and prevention methods, particularly in the community setting. And that the risk of misleading information is really serious on some of these platforms. And because of the latent nature of the content, that this is likely just to continue. So, some of the misinformation that's put on there, and if it's not removed, the more views it gets, the more likely it is to be potentially watched again by more people. So, it kind of comes out as that compounding effect as well. So I can see some real challenges with this.
Yeah, it's interesting that the authors have also done similar reviews on videos on hand hygiene on YouTube, and also on yellow fever. And another group have done a similar search on misinformation on COVID-19 vaccination. So it's certainly something that needs to be watched and observed.
Because, I guess the quick question is then, what's the implications from this? What so what? I mean, interesting piece of work, mind you. But so I think there's an opportunity for us to perhaps use these platforms better. I think it's probably an opportunity for us to be commenting about how quickly some misinformation on these open source platforms can be taken down, and the responsibility of companies and where that sits with respect to spreading of misinformation. I think that's not something we're ever going to be able to answer, and much more qualified people than us to be commenting on things like that. But I think it does really open up the need for that discussion.
Yeah. Well, I mean, it just lends itself to the whole area of fake news, essentially, doesn't it? That's on this platform and many other social media platforms as well, and who's responsible for it at the end of the day.
Well, hopefully we're not spreading too much fake news on this podcast, Phil. So anyway, that's what caught my eye, and hopefully we'll see a bit more. I think there's a lot more opportunity to explore this sort of concept of social media and communication for infection prevention control, and it might spur on others to think about what they can do in this space as well. So
the issue of communication, infection prevention control is it's important, making sure that the messages are correct, making sure that they're tailored for the correct audience as well.
Don't share things if there's misinformation.
That's right.
There's lots of that goes on. We see it on Twitter too, don't we? We see things where people retweet an article without reading it, not really perhaps in realizing what the implications of some of that might be.
Yes.
And that, the way these things work is that the more things get retweeted, the more it gets shared and viewed by other people. So, I think there's a real opportunity to make sure we all don't do that in all the different social media platforms that we
Yes.
might use. Right, Phil, great chatting to you again.
Good to see you too, Brett. And thanks for sharing that article with us. That's it for this episode of Infection Control Matters. Stay tuned. The next one won't be too far away. We'll see you later.